I'm Drew Henderson. I was born and raised in Kentucky and moved to North Carolina for my medical training and spent the better part of the last decade here, and then started 6 months ago with OrthoCarolina. Got interested in orthopedics during medical school. What I put together at the time was that I think orthopedics helps patients. I think patients with orthopedic problems tend to get them fixed, either with surgery or non-operative management. And I thought that was a very fulfilling way to interact with patients. I mostly treat hip and knee arthritis, and so in terms of my patient philosophy, I view most of what I do as elective, and I think of it as always the patient's decision as to when we proceed with an injection or an intervention, and certainly when we proceed with surgery. So my job, as I see it, is to inform patients about the risks and benefits of what we do and let them make a decision and support them in their decision making. I'm going to always tell them honestly what I think is going on, that I'm never going to pressure them into having a surgery that they don't need, and that I will treat them like a family member. When it comes time for surgery, every surgery has risks, and I think generally speaking, hip and knee replacement patients do great. But when the risks of that procedure make sense is always something I want the patient to feel empowered to be the one deciding. In terms of things I do outside of work, most of it revolves around my family. My wife and I have a 15-month-old boy who is kind of a mess, and chasing him around is mostly what I do in the evenings. We also like to spend our lives outside, so we go on walks and we run. I actually play a lot of golf as well, which is something I'm hoping my son will get into someday. But those are mostly how I spend my time.